one moment, we'll get started, and there we go. Please take it away.
Great, thank you so much. Thank you for all of you for being with us for this August 5th briefing. I cannot believe we're already in August. Sorry, we're a couple minutes late here. A lot of information to get through, so I'll try to get through this as quickly as possible. I know that we have some questions that have previously been sent to us. So as of today, 5,758 confirmed. That's a plus 14. As yesterday was a plus 40, and Sunday was a plus 55. And you may ask, wow, these numbers look great. Well, they are not accurate, we believe, and we'll talk a little bit about that in just 1 minute. You can see that our death count has gone up by 2 as of Sunday. So we're sitting right now at 120. 2/3 of that really is because of congregate care. I think we have 80 in the congregate care residential facilities right now. The R0 number is down below 1, which is good. I mean, that's where we want to see it. We'd love to see it continue to trend down. That's really the infection rate. So that is something that we continue to watch. And the area that does concern me, though, is really the growing number of cases in the 20 to 39 range, age range. And we believe that's because of social gatherings. That is an area that we've got to get under control. And it certainly could be the other aspect of it that we're concerned about. And those are those essential workers who live in crowded conditions with multiple families. And we see the spread there also. So it's something that we'll certainly continue to monitor and continue to spread the word on, but it's just concerning to see that age group continue to rise like it is. The hospitalization rate is good. As you see, right now we've got 51 confirmed in the hospital. We only have 2 from outside the county, which is a nice change. We had, I think, up to over 20 at one point in time from outside the county. So that's good to see that drop. We've got plenty of surge space, plenty of ICU rooms. The positivity rate has crept up a little bit to 5.3. And we certainly believe that's a function of less testing taking place through Verily. I think the average days for result 2.43 is not something that we're relying on right now, because we know that the average wait time with Verily is 10 to 14 days in some cases. So it's varying depending on where you go and which provider they're using to get those tests done. And then you look at here, the long-term care facility data. You can see 80 deaths from those facilities. So I talked about the numbers before, and we're a little concerned, and there is a certainly significant and unresolved problem with the state's reporting system for communicable diseases. The California Reportable Disease Information Exchange, CalReady, the health system, as well as the county health department statewide, are experiencing significant underreporting of COVID-19 tests. So significant underreporting of COVID-19 tests. So that's why I say the data that you're looking at here is data that we've been relying on that may be unreliable in it's the information that we're getting from the state. The state has in fact confirmed that the test results data that we have received is valid, in that those cases that we do have are in fact valid, but incomplete. So incomplete. So we don't know to what extent or the issue is with the state or when the state will be able to resolve it. But certainly we're in communication with the state, along with all of the counties, and support the efforts to rapidly resolve this issue. It's important for us to know who has this disease, so that we can then obviously conduct the contact tracing efforts that are so important to trying to stop the spread of that disease. So we're also working with the state closely to implement a parallel procedures, really to assure our staff that we can continue to conduct effective contact tracing and case investigations that we talked about. And until we receive information or confirmation from the state that the data is once again being fully reported, I would say don't rely on these numbers here because they're not completely accurate. We have to wait until the state comes back and says that they have the glitch fixed and that they are reporting fully. So just a little bit on the health facility numbers. We've got 14 guests at the AH Redwood City, and we've got at the AHS Bayfront, we've got 82 guests and 73 rooms occupied. The homeless in various hotels, we've got 98 guests. So we've got 180 individuals housed right now. A couple updates on the health side of things. Saturday, obviously everyone has reported on this now that knows that we were on the watch list, and that resulted in additional closures of some businesses. These additional measures included the closure of gyms, indoor protests, office or non-critical services, personal services, nails, massage, tattoo, hair salons, barbershops, malls. We understand why the state is doing that, yet, we can't necessarily confirm or attribute the spread of COVID-19 to any of these businesses or functions out there. Rather, we have said all along that we believe it's those who are not adhering to the distancing and social gatherings and are having social gatherings. We believe the spread is there, along with those essential services employees who are out there working, providing us services and living in crowded conditions, and many families may be living together. Excuse me. So we continue to focus on those areas. We understand why the state did this, and certainly we're not being critical of the state, but we as a county cannot trace the roots of these businesses back to the spread of COVID-19 or associate these businesses with the spread of COVID-19. So we continue to really emphasize the core beliefs here of social distancing, wearing the face coverings, washing your hands, avoid those large gatherings, and to the extent that you can, and you're participating in those outdoor activities, do it outdoor. Excuse me. People ask, well, how do you get off the watch list? I guess the easy answer is you've got to drop below the trademark metrics for at least 3 days, and then you could potentially come off. The real answer is it's much more difficult than that. The metrics are a moving target at this point in time, in that, like I indicated earlier, we don't know what the actual case numbers are, and we await the state's messaging on that they do have accurate numbers. So we really understand where we're at. For example, the state was reporting that we were at 113 per 100,000 in this county as far as new cases, and it could be much higher than that when we get the numbers. We just have to wait and see. The county testing for Verily, as we indicated, has been capped at 500. We did 2,760 last week, 27,000 total since Verily has started. The testing criteria by Verily remains unchanged at this point in time. But again, that supply chain and results of testing with the labs just being overwhelmed has resulted in a 10 to 14 day turnaround, which is just not acceptable. So that's what we're telling you. If they're insured, please go to those to your primary physician and get tested through that if you feel that it is necessary because of symptoms of COVID-19. And we are also in the process of exploring new ways of testing people in a very targeted manner that would allow us to concentrate on areas where we believe the spread is taking place, whether it be a neighborhood, whether it be a building, whether it be congregate care setting. We are looking at the ability to pivot and really concentrate targeting the testing in those areas. So I think a lot of you were online, but a lot occurred yesterday. The board took very decisive action and bold action in a lot of cases related to COVID-19. And the first one was the agreement with the Renaissance Entrepreneurship for $200,000 in grants for geographically targeted small businesses. But they really put a lot of money into the Housing Impact Program. And that was 2.3 in additional funding to the Emergency Financial Assistance Program for emergency rental assistance. I think that there was approximately $3 million in that fund prior to this. And that is critical, as we know, as people need rental assistance. And this is the new part of it, the really, which I think is very unique. I'm not sure anyone else has done this. The $2 million CARES Act funds to develop a financial assistance program for small property owners, with the understanding that property owners who can't collect rent are being impacted by this also. So it would be a win-win on both sides. If we created that fund for property owners, that would relieve some of the debt of those who are struggling right now. And certainly up to $1 million in legal services for renters, a rent arrears compromise program. We're hoping that some landlords, property owners may want to get more money up front and maybe forgive some of the debt rather than wait for the extended period of time for the repayment, in which, as many of you know, has been extended now to 12 months, as long as you pay half of that rent due in the first 6 months. So we also entered into an agreement with the Community Equity Collaboration and SMCU Community Fund to distribute and administer a previously approved $2 million. So this will go to the child care centers. Again, on that fund, 25 of those grants, of those $55,000 grants, will go to the larger daycare centers, and then $10,000 grants will go to 65 smaller daycare centers. They also, and there was an update on the implementation of the Immigrant Relief Fund. If we go to that map, you could probably see here where the money is being distributed, and all the areas that we would deem necessary. 9.6 million in funding has been committed so far, including $5 million contribution from John Sobrato, who's been so generous here, and $2 million in Measure K funding from the Board of Supervisors. The fund is dedicated to helping low-income undocumented county residents who cannot access federal financial support, and the Mission Asset Fund is administering the grants based on level of need, and families can receive up to $1,000 in grants. So those funds are going very, very quickly, as you can see from the distribution that was already taking place. Additionally, the board approved yesterday $2.8 million in CARES money for the public internet connectivity pilot program that will take place in La Honda, Pescadero Unified School District, Ravenswood City School District, Redwood City School District, and the Sequoia Union High School District. The project will provide up to 12 months of internet access for more than 1,200 students living in East Palo Alto, Redwood City, unincorporated San Mateo, and the communities of La Honda, Loma Mar, Pescadero, and San Gregorio. There's been an additional $1 million of CARES fund to establish a pilot program to provide supplemental funding to school districts that participate in the universal meal programs to reduce food insecurity among students, which is absolutely necessary and a great program. So additionally, there was an approval of an urgency ordinance that allows new penalties for individuals that violate the health orders, including refusing wearing of a face covering. As we talked about yesterday, it's $100 fine for the first offense, $200 for the second, $500 for the third for individuals. And for commercial entities, it could be from $250 to $3,000, depending on the severity of the violation. So we hope that it never comes to that, but to the extent that people just do not or refuse to wear a face covering, there is now a tool in place. We also amended that temporary countywide moratorium on evictions that we talked about, extended it from 6 months to 12 months, as long as the first 6 months is paid. And there has also been newly released guidance for in-person learning and elementary education and the waiver process. Additionally, I mean, the program that just continues to just pay off incredible dividends on both sides, those in need and the businesses, is a Great Plates program serving 2,220 individualized clients, 300,000 meals, with $6 million being put back into the various restaurants in this county for their efforts. And that's just a win-win-win all the way around. Let me, I know we have some questions here, and let me get to them. Okay, so let me get to these questions. And the first one really had to do with who can enforce, or who's going to enforce the mask.
The individual pasted them here as well.
Oh, good, thank you. So with the mask fee ordinance, is there any information on how the order would be specifically enforced and by who? It could be up to really the entities to decide who may enforce this, but I can give you an idea of what the counties are looking at. Certainly the sheriff's officers in this county will, sheriff's deputies in this county can be enforcers, as well as the park rangers, code compliance, environmental health, or anyone else in that enforcement business to go ahead and do it. And we hope that that it doesn't come to that. We really want to educate people. We'd like to, I'm hoping that the entities will be out there with a mask. We're getting our mask mobile out there. We've already had it out there in some of the neighborhoods where we're seeing less compliance. We've asked the cities to tell us if there's less compliance. We're certainly happy to go out there and get the mask and the messaging out there. Our mask mobile is not fully decorated yet, but when we do, we'll get that out to the press. We want it to be visible. We want it to be a rolling message. And we want people to understand that there is the ability to pick up a mask at any time through this mobile. So on to the next question. Our average result rate has gone up a bit, but we're testing less per day. Is this theory behind why that is? Sri, do you want to take that?
Yeah, so just to also reinforce that right now, the test data is incomplete. This data issue that Mike explained, we are working with the state and trying to understand how many test results we're not receiving because of the data issues. That being said, over the last few weeks, as Mike has relayed, the capacity to test at our project baseline site has been reduced by the state to help the lab processing companies keep up with the demand. We also have needed to prioritize time we spent on specimen collection to supporting other key needs like our alternative care side and other supports. Healthcare providers continue to expand how much they can test as they contend with supply chain constraints. And the state has revised the guidelines for who should be tested, and the priorities for testing have asymptomatic folks at a lower priority. So there are a lot of factors that affect the amount of testing going down, and the amount that's reflected on our dashboards also will be incomplete until we work through these data issues.
Okay, out-of-county patients have dropped substantially. The county is still accepting new out-of-county patients. Is there any information on what has happened to those either currently or previously in our care? Many of them got better and went back to the county where they originated from.
And a large segment of this also is related to the San Quentin situation. the state has stood up resources like an alternative care site at San Quentin to reduce the number of inmates that need to be transferred to other counties. We continue to monitor this, but have been pleased to see the decline.
Great. Is there any demographic information on the 2 new deaths?
So the 2 deaths were individuals between the ages of 70 and 79, and their race ethnicity was white.
Great. How are tracing efforts going, and how effective have tracers been so far?
Well, we've really ramped up the workforce of contact investigators and tracers. We're about keeping up, and we're able to reach most individuals. So we are having good trust from our residents. We so appreciate that. It's so important so we can give that guidance early and effectively. This is a huge priority for county health, a core mitigation strategy for breaking the transmission.
Great. And then the last one, I think we've already answered. Positive cases per day have been trending downwards for some possible factors. And really, it's the reliability of the information we're getting from the state is just not there right now. So I think that really explains that. Other questions?
We have a raised hand from Henrietta J. Burrows.
Henrietta, how are you?
I am fine, thank you, and I can see you are too. I read that for Santa Clara County, those who have symptoms are advised to go to the hospital, not to testing sites. So in San Mateo County, what's the advice for those who have symptoms?
You know, I think the advice is the same. We feel, I mean, Sridhar, correct me if I'm wrong, well over 90% of our folks in this county are insured, and we want them to avail themselves of that insurance, go to their primary care physician and get checked out, or the hospital if they're really sick. But you know, we check with the primary care physician first and try to go through that route. Sridhar, any other thoughts there?
Yeah, just to clarify, contact your primary care provider because some of them might be able to give you guidance over the phone or through a virtual visit, but absolutely your primary care provider is the best source of advice, and we want your provider to have the test results if you are recommended for testing.
So most of the people being tested at the test sites, are they asymptomatic or do they actually have symptoms?
I think it varies. Sridhar, do you have more thoughts?
I don't think we collect information, but many people are asymptomatic and may have been looking for a place to get a test that does not have to be ordered by your physician. Every healthcare system is prioritizing those who have symptoms where the clinical decision would matter. But we probably have also had individuals who, you know, are not sure, they're not feeling great, and they want to reassure themselves.
Thank you.
Okay. Any other questions?
Those are all of the raised hands. We do have a couple more in the chat. Can you clarify which parts of county data appear to be affected by problems in the state reporting and which should not be?
So we tried to explain that in a disclaimer that we put up on the website today. I would encourage everyone to please read all of that. But the data issue involves lab results. So that's lab data, case data, information that is about the positive cases, the positivity rate. So it's not the hospital data, but it's all the data that's related to cases.
And then any idea as to how long the state's data has been unreliable?
It's our understanding that this became known on July 25th. And so we're learning more each day.
Great. Those are all of the chat questions, and I don't see any other raised hands.
Great. Thank you all very much for being with us. Stay safe, and we'll see you back here next Wednesday.